Hello, everyone. I am going to introduce myself, so let me start there. My name is Tiffany. I am a master level clinical mental health therapist who is also completing my certification on juvenile sex offender treatment. So, what I'm going to do today is share an informational video that I created just to educate my colleagues and others that are interested in knowing more about the juvenile sex offender population and what we commonly see when working with this population. This is actually my final stage in my certification project. I needed to complete it in Inservice. However, COVID 19 has changed the way we do things. Therefore, I had to be a little creative in how I got this message across. So, if you actually listen to this video, could you please like it for me and leave any comments so that when I submit it to my trainer and educator in the curriculum and they view it, they can see that people actually listen to it and hear what the questions or feedback is. So thank you in advance for that. Again, just a little bit about myself. Like I said, I am a master's level clinical mental health counselor. I am a registered intern in the state of Florida. I graduated from Regent University with my master's in clinical mental health counseling in 2016. I have always enjoyed working with the juvenile population. However, when I relocated to Florida, slightly under 2 years ago, I had the opportunity to work with juvenile sex offenders and come to realize that I really have a passion for this population. So there's a couple of things I want to say like right off the bat. And one of those things is that this presentation is not designed to minimize or erase the wrongs that occur in sexual offenses. This presentation is designed to raise awareness as well as facilitate objectivity and a greater understanding of the elements that are included in the world of a juvenile sex offender. This is not an exhaustive list or understanding. See this as a platform for you to build upon. If you are in the healthcare profession or the mental health profession, I believe that empathy, unconditional positive regard, open mindedness, and remaining unbiased are traits that should be a part of your character. If you are religious or Christian, forgiveness, being non judgmental, and dispersing grace should all be frequently used tools in your toolbox. If you just consider yourself a human being, you don't really identify with either of those, you understand the concept of right or wrong. And hopefully, you've experienced grace and mercy for the wrong that you've done. With that in mind, let's explore the world of juvenile sex offense or juvenile sex offender. So, what I've done is I've created like some flashcard type things. You know, I love PowerPoints. However, I am still kind of an old school person. I like to write and see things. So I'm going to show you some flashcards just in case what I'm saying is not enunciated clear enough for you. You can also see, and then hopefully you can gain or glean the information for my explanation. So first, let's talk about the term JSO. The term JSO, when you hear me say this term, it refers to a juvenile sex offender. Okay? So a juvenile is a legal juvenile under the age of 16 or 18, depending. So another term you're going to hear me say is age of consent. The age of consent is the age at which a person is able to consent to sexual intercourse and is valid in law. This is really important, guys, because the age of consent is what we have found, or I have found in my work with juvenile sex offender, has really been the thing that determined that the youth was indeed a criminal. And note, the age of consent varies from state to state. It is very, very important. Parents, it is very, very important. Youth, it is very important. Educators, please know what the age of consent is in your state law. Not only in your state, but know the federal guidelines. This is going to save you some headache later. The next term that I'll refer to is counselor or therapist. I'm sorry, you can see my writing on the back. So here I just want to talk about what the role of a counselor or a therapist is in a juvenile sex offender program, okay? So one of the things that counselors or therapists like myself do is establish a balanced relationship and model respect. Balanced relationship, guys. To me, that says boundaries. So therapists or counselors establish boundaries up front and they model respect, right? So part of modeling respect is the key in how the youth is going to learn how to be successful in respecting others in the future. So that's a big deal. The second is setting clear goals for assessments and treatment, both present and future. So, whenever a person is involved in treatment, there are always therapeutic goals, right? If there is no goal, there is no purpose in coming weekly or however frequently you have to come. So there has to be some present goals and there has to be some future goals. The present goal represent where you are now. When I come into treatment, this is where I stand and this is what I would like to see. The future goals hopefully reflect a healthier version of the person being treated, okay? The therapist or the counselor is also the person who remains vigilant for any acceptance of responsibility for abuse. This is also a big deal for counselors and therapists because we have to remain vigilant. We have to remain always hyper focused on making sure the person in treatment is accepting responsibility for the abuse. The other role for the counselor or therapist is help the perpetrator, and the perpetrator is the alleged person that committed the crime. Label abusive behavior correctly. Here, this is why this is a big deal because social media, music, things like that glorify sexually abusive behaviors. We have seen people minimizing slapping a girl on the butt, staring at her, looking at a male genital area for a long period of time as normal. All right, we have to debunk that. We have to help our patients, our people in treatment realize that certain things are not normal behavior, okay? It is not okay to just slap somebody on the butt without their permission. It is not okay to stare at someone's genital area for long periods of time and romanticize about that. That is not okay. So, the role of the counselor or therapist is to help that perpetrator or the person in treatment label their tendencies correctly. Another very important goal and role for the therapist or counselor is to introduce the therapeutic theme of respect and trust. Again, respect and trust are themes that people in treatment for sex offense have violated or have allegedly violated, all right? So it's going to be very important to make sure that the theme of respect and trust is always present. Also, help the perpetrator recognize and label achievements. So that's give praise where praise is due. Notice the development of integrity and inner strength. Development of integrity and inner strength, typically I've seen come as the treatment process continues. So really after the patient has accepted their responsibility, I typically start to see that they're developing some integrity and some inner strength to just even acknowledge that, hey, this is what I did, this is where I was wrong, and attribute the significance in their achievements in light of their goals. So help them connect the dots to how their current and new behaviors are aligned with their treatment goals. So next, outpatient treatment. So outpatient treatment is also known as community treatment. And community treatment is appropriate when the perpetrator is is clearly aware of what they've done, when they're open to discussing the details of their actions. This is big because if the perpetrator can easily answer questions and say, well, I don't know or I don't remember, it may be unclear whether or not they are really aware of what they're done and whether or not they are really open to discussing the details. And discussing the detail is not to glorify their behavior, but to help them with the acceptance and responsibility piece of the behavior. Community counseling is also good for people who do not have a history of repeated offenses. So, if it's a one-time offense, community counseling is usually recommended after the psychological evaluation. However, if they have multiple offenses, community or outpatient treatment may not be encouraged. The other really big piece is that the person in treatment, the perpetrator, is psychologically stable enough to control their actions. This means they are aware of their triggers, they are aware of their impulses, and they're able to control them, and they have been able to demonstrate the ability to control them. So that's really big. When they don't meet those requirements, residential treatment is what's typically recommended post the psychological evaluation. So, in a residential treatment program, the residential treatment program provides intense preparation for perpetrators who are not ready for community based treatment. Treatment, whether it's inpatient or outpatient or community based, requires the assumption, and we all know that we shouldn't assume things, but in this instance, we assume that change is desired by the perpetrator, all right? And so we move from the assumption to the realization throughout the treatment process as the perpetrator, the person in treatment, is able to accept responsibility and accountability for their actions and learn and demonstrate new and improved healthy behaviors. In treatment, clinicians are able to engage the part of the perpetrator that wants to change. So, yes, the therapist or the counselor is going to talk about that person that did the bad or the criminal act. But what we're really wanting to do is to engage the part of the person that wants to change and help them facilitate that change. That's really a big deal. So, CBT, that acronym stands for Cognitive Behavioral Therapy. Typically, any sex offender treatment programs really use cognitive behavioral therapy modalities. And that's because cognitive behavioral therapies are really helping a person reframe their thinking, right? Cognitive behavioral therapy to change one's thinking or thinking patterns with the hopes of fostering new and healthy behaviors. Solution focused therapies and expressive therapies have also been helpful in treating sex offenders. All right, so now I want to talk about 6 sexual disorders. Yes, 6. According to the DSM-5, which is the diagnosing manual that clinicians and therapists use, there are 6 sexual disabilities. The first one is exhibitionism, fetishism, frautism, pedophilia, voyeurism, and paraphilia not otherwise specified. Now, when diagnosing these or looking at symptoms related to these disorders, the specifiers are either mild, moderate, or severe. In a mild case, the person has urges but has not taken action. In moderate cases, they occasionally act. So there is some limited self-control. In severe, repeated acts, no self-control at all. So first, let's talk about exhibitionism. And I apologize. I still struggle to say these words sometimes. So, for all of these disorders, there's a requirement of at least a 6-month history. All right. And so for exhibitionism, it's 6 months, period of 6 months, where recurrent sexual urges and sexual arousing fantasies involving the exposure of one's genitals to an unsuspecting stranger. The person has acted on the urges or is markedly distressed, which means that they really want to do it. So an example of a exhibitionist would be a youth in a residential treatment program that is aroused by masturbating in front of peers or staff. Okay, so that's an example of that. Fetishism. Again, over at least a 6 month period, reoccurrent, intent sexual urges or sexual arousing fantasies involving the use of non living object by themselves. The person has acted on the urges or is distressed. Again, they really, 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 really want to do it. Another thing to consider is the items are not only female clothing used in cross dressing or devices designed for like um, genital stimulation, like a vibrator. An example would be a youth stealing and hiding female underwear to sniff while fantasizing and masturbating. That would be an example of fetishism. Freuderism. Again, 6 months, reoccurring, intentional sexual urges and sexual arousing fantasies involving touching and rubbing against a non-consenting person. Non-consenting person, okay? So that means the person that's being rubbed up against has no idea what is going on, okay? And they did not say, hey, come do this to me. The person has either acted on these urges or has a strong impulse to do so. That's what markedly distressed means. Example, a perpetrator constantly accidentally bumping into people and brushing their genitals up against the person and getting an arousal. All right, you see a lot of that in treatment in residential treatment places. Next one, pedophilia. Again, 6 month reoccurring intentional sexual urges and fantasies involving sexual activity with a prepubescent child or children 13 or under. So this is sexual urges and fantasies involving a child who has not yet reached puberty. Okay? They have acted on or is severely distressed by their urges. So they really, really, really want to do it. In this case, the person has to be at least 16 years old, and the person, their victim, has to be 5 years younger than them. So that's big to know. So you can't just go around calling people pedophiles if they don't meet the criteria. All right? So, also, something very important to know about this behavior is the person cannot be identified as pedophilic if they meet the criteria for gender identity disorder or non-transsexual type or transgenderism. An example, a 17-year-old perpetrator sexually abuses his or her 9-year-old stepsister or brother and displaying grooming behaviors. All right, so that's an example of pedophilic behavior. Pedophilia not otherwise specified. I'm sorry if this is a little blurry. So in this category, this refers to instances that does not meet criteria for any other diagnosis. So examples are telephone scatophilia, which is also called lewdness. Necrophilia, which is a fantasy with corpses, dead bodies. Partialism, which is exclusive focus on body parts. Zoophilia, focusing on animals. I think it's cophobia, which is focused on feces. Clismophilia, which is focused on enemas. And urophilia, which is focusing on urine. Now, I've had some encounters with people or I see the charge of lewdness behavior a lot in a lot of juvenile charges, but I haven't really seen anything with corpses. I have seen some zoophilia where people are, perpetrators are obsessed with animals. I think some people refer to this as bestiality. And I have actually seen a few people that have been really consumed with feces in terms of sexual arousal. So All right. All right. Voyeurism. Voyeurism is 6 month recurrent intense sexual urge or sexual arousing fantasy involving the act of observing an unsuspecting person who is naked or in the process of engaging in sexual activity. Again, in this instance, the person has acted on the urge or is very distressed and wants to act on the urge. An example of this would be a perpetrator who secretly watches his or her parents have sex through their bedroom window. All right. So those are the 6 disorders. All right. I want to talk about sexual dysfunction in the specifiers. So when we're talking about sexual dysfunctions, the specifiers are either lifelong or acquired. So they've always been present or they were acquired over time. Generalized or situational. So in general, this person does that, or in specific situations. Same sex, opposite sex, or both. Limited to incest. Exclusive type, which could be attracted only to children, or non exclusive type, meaning it doesn't matter. They're attracted to anyone. 3 sexual dysfunctions. The 3 sexual dysfunctions are sexual masochism, sexual sadism, and transvestic fetishism. And again, I apologize if I'm not enunciating properly. I still struggle with the correct enunciation of these words, so please forgive me. Let's talk about sexual machoism. Again, 6 months, recurrent intense sexual urges, and sexually arousing fantasies involving the actual act, not anything that's simulated. It has to be real. Of being humiliated, beaten, bound, or otherwise made to suffer. Acts on these urges or markedly distressed by them. So I will say that in the juvenile arena, I haven't really seen any of this machoism. If I've seen it, it hasn't manifested itself in totality for me to give a diagnosis. So I'm not saying that it doesn't occur in juveniles. I'm just saying I personally haven't seen it manifest to be able to diagnose it. Sexual sadism. Again, 6 month recurring intense sexual urges and sexual arousing fantasies involving the act. Again, it has to be real, not simulated, not pretend. It has to be real, in which the psychological or physical suffering, including humiliation of the victim, sexually excites the person. The person has either acted on the urge or is markedly distressed by others. An example of this, and I think I've seen this in mild cases where if you're in a residential facility and someone is being restrained for some reason, I've noticed that there are some children that will kind of go off to the side, but not because they want to avoid it, but because they are really aroused by what's going on. And if in times that I've watched closely, I've noticed that they will become sexually aroused. So their penis will become erect, or they would start to fantasize, and usually they would have an episode within a certain time frame. So I've seen some mild cases of this in residential treatment. The last one is transvestic fetishism. Again, 6 months in a heterosexual 6 months in a heterosexual male, recurrent intense sexual urges and sexual arousing fantasies involving cross-dressing. So again, this disorder specifically talks about heterosexual males. All right, so this is important because sometimes in play or just in daily conversation, we use terms incorrectly. And we want to make sure, especially when we're using psychological terms or mental health terms, I apologize for the noise. I'm on my patio and a truck is going by. That we don't mislabel people. All right. Again, in this instant, the urge is there or the need to do it is really, really big. All right. So now I'm just going to go ahead and go over a few terms that are very popular in the GSO, juvenile sex offender treatment environment. All right. The first word, victimization. When we're talking about victimization, we're talking about the act of making someone a victim. Okay? So whenever it said victimization, that's what we're talking about. The word sex offender. I have found in treatment facilities the youth despise this word. They say we are not sex offenders. I'm never going to say that I'm a sex offender. I'm giving you the Merriam-Webster dictionary definition of these words. And so, based on the dictionary, a sex offender is a person who has been convicted of a crime involving sex. So, what I always tell the youth and the people that I provide treatment to is if you have been convicted of a crime involving sex, you are indeed a sex offender. Do we want to change your behaviors? Absolutely. But based on the definition, if you've been convicted of a crime involving sex, you are a sex offender. And that's big because one of the reasons why I want to say this is big is because there is a sex offender registry, right? And so everyone that's on the sexual offender registry has not necessarily committed a crime involving sex. So it's very important that when you look at the registry, one, that you know your state laws, right? So not only your law of consent, but any state laws that require or lead up to registry. But when you're looking at that registry, that you're going into the details of that person to find out if they had a crime involving sex. Because there are times when there are not crimes that are involving sex. Again, not minimizing the behavior. Goal is to educate and provide some objectivity. Shame. Shame is another word that we hear a lot in the behavior that we see in juvenile sex offender treatment. Shame is defined as a painful emotion caused by consciousness of guilt or shortcoming. So, in a healthy person, there is a degree of shame. So, there is a degree of appropriate shame, right? That as a therapist, I'm looking for, right? I don't want the person to continue to beat themselves up, but I do want to see that there's some shame or some remorse. Remorse is probably a better word. I'm looking for some remorse for the behavior, okay? Guilt. So, guilt. The fact of having committed a breach of conduct, especially violating law and involving a penalty. So in the juvenile sex offender treatment program, typically the penalty is putting them in treatment, right? And also the penalty could be registering as a sex offender. Also another definition, according to the dictionary, the state of one who's committed an offense, especially consciously. So in these incidents, we're not talking about someone who's pleaded temporary insanity. Nope, you were coherent, you were conscious, you knew what you were doing when you committed this act. Also, feelings of discerning blame, especially for imagined offenses or from a sense of inadequacy. So again, just some definitions of guilt. Big word, empathy. I find that people don't know the difference between empathy and sympathy. I'm not going to go through a whole detailed thing of the difference between empathy and sympathy. I will say that this is a word that comes up in treatment all the time. The definition of empathy is the action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another, of either the past or present, without having the feelings, thoughts, and experiences fully communicated in an objectively explicit manner. So, what we really tell our youth is that empathy is putting yourself in someone else's shoes. How do I check for empathy? If the predator is not able to talk about the collateral damage done, then I question whether or not they are truly empathetic, right? So if I hear things like, oh, she deserved it, she wore a tight shirt, or she was old enough, well, she said she could do it, I didn't know about consent, that youth may not yet be empathetic to what has occurred. The victim. The victim is one that is acted on and is usually adversely affected by a force or agent. One that is injured, destroyed, or sacrificed under any of the various conditions. Grooming, another very big word in treatment. To get into readiness for a specific objective. So let me say this about grooming. There is not a sexual crime committed or a behavior committed that is not preceded by grooming. Something occurs in the grooming process that sets the victim up to become a victim. Okay? So those that commit sexual offenses may struggle at first with identifying the grooming behaviors, but therapists, you guys all know, those of you that work in this field, the grooming behaviors are there. Pornography, another big deal in the treatment world, because again, pornography is something else that people minimize, right? Playboy magazines in the old days, explicit videos, X-rated videos, constantly seeing it glorified half-naked women and men, or men or women wearing clothes that's so tight you see their genitals, right? Are all forms of pornography. So pornography is defined as any material, either picture or words, that is sexually explicit. The depiction of erotic behavior, as in picture or writing, intended to cause sexual excitement. A depiction of acts in a sensational manner so as to arouse a quick, intense emotional reaction. So, pornography arouses the person, right? That's what we're looking for, the arousal. So people say all the time, oh, I look at pornography and it doesn't affect me. Okay, I'm not there. I can't say that does or does not happen. But when we're talking about pornography, we're talking about it arousing people and the effects that come and the behaviors that come after the arousal. Abuse. To use something or someone for a bad purpose. Misuse. To treat a person or animal with cruelty or violence, especially regularly or repeatedly. So, here, abuse can be a single time, it can be repeated times, right? And it's against a person or an animal. Again, we talked about bestiality, or, having an attraction to animals. Sexual assault. Sexual assault is the illegal sexual contact that usually involves force upon a person without consent, or is inflicted upon a person who is incapable of giving consent, as because of age or physical or mental capacity, or who places the assailant, such as a doctor, in a position of trust or authority. So, sexual assault. The things that is very important to remember about sexual assault is the age of consent is important here. So again, know your state laws, know the federal law. Physical or mental consent, right? So people with certain limited mental capacities or developmental capacities are covered under sexual laws. So if someone who is delayed developmentally may not have the capacity to consent for sex, that's important. Keep that in mind. Also, people that are in power or authority, right? So this is where we get into the issues at work, where people like doctors, supervisors, or people in high position sexually assault people that are in lower positions than them. So just make sure you're always aware of your behavior and how your behavior can be perceived by others. Statutory rape. Statutory rape refers to sexual intercourse with a person who is below the statutory age of consent. Again, state law, federal law. Know it. My practice is what I tell my kids: know the federal law. If the federal law say anyone under 18 cannot engage in consensual sex, I would not engage with anyone in sexual activity who's under 18. I just wouldn't risk it, I tell my kids all the time in treatment that, hey, you might want to be asking for birth certificates to prove birth certificates with seals on them to prove the date of birth, because there are cases where victims lie about their age, or victims look more mature than they are. And again, this is not to put any blame on victims, but for people to understand that you are responsible for your own behavior. So you are responsible to do your own due diligence in knowing that the person that you're engaging in sexual activity is of legal consent age, and that they actually want to engage. So at any point, stop means stop. Doesn't matter, as the kids say, but I might get blue balls. Well, you rather get blue balls than to get criminally charged and have to register as a sex offender. That's my rule of thumb. Rape. Unlawful sexual activity, and usually sexual intercourse carried out forcibly or under threat of injury against a person's will, or with a person who is beneath a certain age or incapable of valid consent because of mental illness, mental deficiency, intoxication, unconsciousness, or deception. So this is where the corpse thing comes in. Even though I've never personally, had to counsel anyone that has got involved, but raping a dead person is still rape because the person isn't conscious. So if someone is intoxicated and they pass out, it's rape. One, they're intoxicated. Two, they're not conscious. So again, a person beneath a certain age of consent, guys, know the age of consent. A person who has delayed mental capacity, again, autistic youth, may not be able to consent to sexual consent. So not to single out autistic kids, but I'm just wanting to give you an example of things where delays might come into play, so you make sure you get consent. All right. And then the last word I'm going to define is a predator, because I've used it so much. A predator is a person who looks for other people in order to use control or harm them in some way. So a lot of sexual crimes are about control, right? So controlling or harming, that's what a predator is, okay? So those are the terms that we frequently hear in a juvenile sex offender environment and treatment programs. Those are things, accountability, and things that we are looking for, and change behavior and change thinking patterns for people that are engaged in treatment. So treatment does not just involve the person that offended, it also involves the family, right? And so a lot of offenders have offended against someone in the family, so it makes it very difficult for them to receive support and treatment. But we do like to encourage families to participate in the treatment process, because the whole family has to heal, the whole community has to heal. So we like to engage everyone in that process. That's really what I wanted to share with you guys. Like I said, I'm going to post this YouTube video. And if there are any questions or anything, and please post them, and I am going to do my due diligence to respond, so that it could have the question and answer type feel that it would have been if I would have had the opportunity to present this. But before I go, I want to give you some more things to consider. One, all juvenile sex offenders do not have criminal records, meaning they have not committed violent crimes. Okay? Many juvenile sex offenders were exposed to sex prematurely by parents, caregivers, family, and friends. Many juvenile sex offenders were victimized and never received treatment for the offense towards them. Pornography can lead to being labeled as a sex offender. Social media and media devices has increased the frequency of alleged sexually abusive crimes. Please be aware of your professional biases, your cultural biases, and cultural norms, how home environments and school life facilitate sexual abuse. Know the law. Ignorance is not excusable in the court of law. So just because you don't know doesn't mean you're going to get off. Juvenile sex offenders are individuals under the age of consent, right? They're someone's sons, someone's daughters, they're people in your communities. They are two human beings, right? Remember that. Yes, they've done some egregious things. They are human beings. And I believe in rehabilitation, so which is why I'm passionate about this field. Some takeaways. Parents, please parent your children. Do not allow your children, regardless of their age, to interact in media devices or on platforms for long periods of time. Monitor electronics, games, social media. Remember, those things are privileges and not rights. If the age to have a Facebook page is 18 and your child is 12 and they have a Facebook page, that means that if you know about it or you help them create it, you've assisted them with being dishonest. So you've taught them something about it being okay to be dishonest and get what you want, right? So you're part of the problem, maybe in a small sense, but a part of the problem, right? So don't allow your kids to have access to things that they are not developmentally ready for. Even if you feel like your child is mature, find an age appropriate platform for your child. Okay? Unsupervised time on these apps and things like that really prevents opportunity for predators to seek your kids out. Okay? And it also allows predatory behavior to begin. So there are some people that are victims, there are some people that are predators. Your child could develop predatory behavior if they're watching large amounts of pornography and you don't know that because you're not supervising them. Take their devices. Please parent your children. Pornography is not a rite of passage. I know a lot of people feel like it, but it's not a rite of passage. Assessing pornography is an adult decision. If you introduce a minor to pornography in any form, you are demonstrating predatory behavior. I'm serious about that, guys. Do not introduce, guys, girls, it was, I'm saying, do not introduce your kids to pornography. That's not cool. All right? If you allow your child to have everything in access that they want now, they will have nothing to look forward to as an adult. Monitor, measure, and mimic the law in your homes. Monitor your child's behavior. Measure the amount of time that they're allowed to be on certain platforms and engaging with other people and in certain activities. And mimic the law. Parents know the law. If your child is 14, your child should not have a boyfriend. They are not at legal age of consent. If they're dating someone that's 17 and they pressure to have sex, you've put your daughter and that child at risk. Protect your kids. Protect your community. This is a big deal. Again, my intent is not to offend or to minimize, simply to educate and help us become more objective and more accountable and responsibility individually and collectively in our communities. I hope that this has helped you. Again, my name is Tiffany. I am a master level clinical mental health counselor. I am registered as an intern in the state of Florida, and I enjoy working with the juvenile sex offender population. I believe in their rehabilitation. I believe that they can be whole. I believe that it's a difficult task, but difficult is not impossible. So you guys stay safe, stay aware. Please respect the COVID guidelines. Please respect the law. Please respect others' boundaries and have boundaries of your own that you enforce daily, repeatedly, and that are healthy. Sending you guys love and light. Have a great day. Bye.